Sounds rolling too. Welcome back to Midweek Mindcheck. My name is Lee, and with you right now from IU.care is Dr. Panda or Tushar Panda. How are you doing? How is this morning going for you?
Yeah, I'm great.
Yeah,
Thank you, Lee.
lovely. This morning we've been talking about so much about mental aspects and mental health issues as well. So I thought this time we'll get into depression and talk a little bit more about this, expand on it a little bit more, and get the idea of what exactly is it and how can people ask for help. So right off the bat, what is depression, and is it different from people who suffer from regular sadness or low moods? How do you differentiate?
Right. So, depression is a common mental health disorder.
Mm-hmm.
It is characterized by intense and persistent low mood or sadness.
Mm-hmm.
Along with that, there are a lot of other symptoms. People are unable to experience pleasure or enjoyment in things they earlier enjoyed. There are sleep issues, appetite changes, there are pessimistic thoughts, hopelessness. Along with that, there are many somatic symptoms like body aches, headaches. And in severe cases, we often see patients have self-harm ideas or suicidal thoughts as well.
Right. Now people hesitate to ask for emotional help. When they're going through this, they find it like a sort of like a thing of shame to ask for help, right? So what are some clear signs or indicators that should prompt someone to reach out to professionals for help in this aspect when it comes to depression?
Yeah. So whenever it is persistent, it is severe, and it leads to social, personal, or occupational dysfunction, then one should seek help. Additionally, if there are some self-harm ideas or some suicidal thoughts, then that is a red flag and it should immediately need professional help. And in addition, if you're experiencing headaches, backaches, appetite changes, sleep changes, which are not explained, then it's best to consult a psychiatrist.
Right. So you're saying that if it prolongs for more than 2 weeks is when you have to actually be like, this is not normal, or this is a sign of a bigger something, some bigger issue, right?
Yes.
Because we do have mood swings here and there. You do feel like a little bit low on certain days, but that doesn't mean you're depressed. Right?
Exactly.
That's the main issue, right?
So everybody feels sad from time to time, but in depression, the sadness persists for a long time, at least for 2 weeks. And along with that, there are a lot of other symptoms
Right.
that we just discussed.
Yeah, correct. Now, for those considering a psychiatric appointment, what can they expect in terms of the process of diagnosis, as well as the kind of questions or assessments involved in this process?
Right. So whenever a person comes for psychiatric assessment, usually they can expect that we will discuss in detail about their emotional health as well as physical health if required. So we take a history of how the symptoms developed, how it progressed.
Yeah.
We also look for past history or family history of mental health issues, other medical issues that might, come along with depression. We also look for any psychosocial stressors that might be contributing to the depression. And then we try to do use some questionnaires or assessments if required, if the diagnosis is not clear or we want to understand the severity of the problem.
Right. Can you explain maybe a couple of questionnaires of what they may be going through? Like how, what are they called?
So there are a lot of questionnaires and assessments. Most of them are pen and paper based.
Okay.
So there's something called as Beck Depression Inventory or Hamilton Depression Scale. So these things are used to assess the severity of depression, whether you're suffering from mild depression, moderate depression, or severe depression.
And are they considered accurate in this day and age in terms of in the psychiatric world?
Yes, they have been well researched and they have their sensitivity and specificity. So they are accurate to most extent.
Perfect. And what about investigations? Are there any investigations done in the field of depression?
Right. So investigations per se are not used to diagnose depression.
Okay.
However, sometimes we use some investigations, some blood investigations, when we think that there are other comorbid disorders. Like many physical disorders like anemia or thyroid disorders have symptoms which overlap with depression.
Okay.
So to rule them out, we use investigations, but they are not used to diagnose depression per se.
Right. So you can't really use a blood test to say that, okay, this person has depression, but it could be a sign of a comorbidity with them.
Exactly.
Some other underlying illness that maybe, could that be causing the depression, or does that come with it?
Both are possible.
Okay.
It could be that the physical illness is causing the symptoms that is appearing like a depression. For example, if you have anemia, you have low hemoglobin in blood, then you may feel weak.
Right.
And that may look like depression.
Okay, interesting. Now, what is the treatment process? Because this one is kind of tricky, right? But you have different things on how to attack, depression and fight depression, as they say. So, what is the process to treat it, and how long does it take to get better? I know this is a very, the last part is maybe a little bit, can't give a specific answer, but in your own words.
So, basically the treatment of depression can be classified into medications, what we call as antidepressants,
Okay.
and then psychotherapy. So
Okay.
psychotherapy consists of many psychotherapies, but CBT, cognitive behavioral therapy, interpersonal therapy, these have most evidence.
Okay. So
Now-
CBT and
IPT, interpersonal therapy.
okay.
But the treatment may take some time. It may take somewhere between 2 to 6 weeks, sometimes even longer. The reason is that, see, we understand that depression, biologically speaking, occurs because of imbalance in our neurotransmitter in specific areas of brain.
Okay.
So there is this neurotransmitter serotonin, which
Serotonin,
we
yeah.
understand that is low in key areas of the brain. So antidepressants increase the level of serotonin in those specific areas,
Right.
and it might take some time. From a psychological perspective, if we talk about CBT or IPT, they help us in understanding our thought patterns and improving our coping styles. So that also takes some time. So patience is important and it takes time.
Right. Now, when you mentioned neurotransmitters, right now, this, I feel like some people may not understand what this is. So, just to quickly summarize what it is. What exactly is a neurotransmitter?
So a neurotransmitter is a chemical in the brain which transmits information from one neuron to another. A
Okay.
neuron is the unit, a cell, basically the unit of the brain. So it transmits information from one cell to another.
Right.
Like if you remember Lage Raho Munna Bhai, there is the term chemical locha.
Right.
So a imbalance in the brain neurotransmitters.
So when
so
you
that
have when you have a less of a certain transmitter, it could result in depression, which is serotonin basically.
Yes, that is the most prevalent hypothesis now, that
Okay.
these chemical imbalances cause most of the psychiatric disorders. And that is how the medicines try to treat them.
Right. Okay, interesting. Now depression not only affects individual experiences, but also the people around them, because you are your own world and you have your friends also who are in touch with you, right?
Certainly.
What advice would you give to people who are trying to support somebody in their circle who's going through depression?
Yeah. So caregiver burnout, caregiver fatigue is a real thing.
Right.
So the first thing is that they should prioritize their own health, take care of their own health. Secondly, they should be empathetic towards them in relation to their problems. And if they find that someone is going through depression, they should help them seek treatment, because they themselves might not be motivated to do so because
Right.
of the hopelessness and pessimism. They might not be interested. So you have to help them to seek treatment.
So you're saying that, so your friends and family also play a huge role in this. So they have to
Exactly.
sort of not coax you, but encourage you to get the help that you need, right? But
Yes.
how do you do that first step? That first step is kind of scary, right? To be like, okay, listen, I don't think you're doing too well. How does one approach this very delicate topic?
Right. So first and foremost, create a space of non-judgmentality. We understand what you're going through, and we try to help you. I know you are also trying to help yourself, but you're not able to do it. So why not take some help? What the harm that can happen out of it?
Yeah, I think the whole idea that it's okay to not be okay has to really get into people's heads even now, right? And asking for help is not a sign for weakness or of weakness, right? Because that's the main idea about this. We also hear about early interventions and self-care, practices that can reduce the risk of developing depression. What are these small things that we can do in our daily lives so that we can, not avoid, but try to avoid depression?
So given how common depression is, all of us should do something to prevent depression. There are certain factors. There are genetic factors. There are biological factors which are not exactly under our control. But on the other hand, lifestyle factors like having a regular sleep pattern, eating a balanced diet, exercising regularly, increasing our social connections, these are things we all can do. And they can help in a great way in reducing the risk of depression.
Right, definitely. But I'm sure it's hard for people who are depressed to really get out there and do these activities.
Yes, when someone is depressed, there is lack of energy and there is no motivation, there is no hope. So
Right.
it can be really difficult, and giving them advice also does not help.
Perfect.
So in those cases, it's necessary that they're encouraged to seek help.
Right. And I think even if you don't really have depression, it's okay to talk to a psychologist or psychiatrist once in a while, just to keep a track of things, right? Of like how you're going, how you're progressing, right?
Certainly, if you are having any emotional distress, any kind of emotional struggles, even if it does not amount to depression, the criteria that we have said that it does not
Yeah.
meet 2 week criteria, it does not require to wait that long.
Correct.
If you feel that you are going through an emotional struggle, any emotional issues, then it's perfectly okay to consult a psychologist or a psychiatrist. Psychotherapy helps in preventing
Definitely.
depression in those cases also.
Definitely. Well, to know more about this, please log on to ayu.care, which is ayoo.care, or get the app as well. They are a mental health service. And thank you once again, Dr. Tushar, for joining me this morning to discuss depression and how we can avoid it. And if you are going through this incredible battle, how to face it and get the help you need. Thank you once again. And any last message to all the listeners out there?
My last message is depression is very common, and if you are suffering from depression, there is nothing to be ashamed, and please seek help as soon as possible.
Perfect. Ayu.care, which is AYOO.CARE. Thank you once again.
Thank you, Lee.